Hi everyone. So this is the final section in our induction session, making sure that we cover all of the really key information about COVID-19. So again, I'm going to share my screen, and this section is looking at self-isolation and what that means. And then it also goes through some of the safety measures for us at school. So self-isolating. What is self-isolation? So self-isolation is when we have to stay at home because you have or you might have coronavirus, and it stops the virus spreading to other people, which is why it's so important. So self-isolation is different to social distancing, which is the general advice for everyone to avoid close contact with other people. And it's also different to shielding, which is advice for people at high risk from coronavirus. So you self-isolate immediately if you have any symptoms of coronavirus, such as a high temperature, a new continuous cough, or a loss or change to your sense of smell or taste. Okay, that's one reason why you would self-isolate immediately. You would also self-isolate immediately if you've tested positive for coronavirus, which means that you have coronavirus. You would also self-isolate immediately if you live with someone who has symptoms or someone who has tested positive. And you would also self-isolate immediately if someone in your support bubble, not necessarily your school bubble, but if somebody in your support bubble has tested positive or has symptoms. Okay. And then finally, you would also self-isolate immediately if you are told by NHS Test and Trace that you've been in contact with somebody who has coronavirus. So how to self-isolate, okay? If you're self-isolating, you and anyone you live with must not leave your home. So this again is from the NHS website. So don't go to work or school or public places, okay? If you can do work from home, then do so. And we at school will provide work for you to do. Do not go on public transport or use taxis. Do not go out to get food and medicine. Okay, you can either order online or by phone or ask someone to bring it to your home. Do not have any visitors in your home, including friends and family, except for anyone providing essential care. And do not go out for exercise. If you need to exercise, exercise at your home or in your garden if you have one. And how long do you self-isolate? Well, if you have symptoms of coronavirus, you will usually need to self-isolate for at least 10 days. And you will usually need to self-isolate for 14 days if you live with someone who has symptoms of coronavirus, or if you've been told by NHS Test and Trace that you've been in contact with someone who has coronavirus. So because of all of these things that we've been talking about, we at Bridge and schools across the country, schools across the world, have put in place a range of safety measures to make sure that we are all as safe as we can be. Okay, hence the picture of the bubble. So every year group is now in a bubble. I'm just going to move my image out of the way there. Every year group has become a bubble, okay? So for entering and leaving the building, we have staggered start times and end times for year groups. So 7 and 10 both start at the same time. 8 and 6 form start at the same time, and years 9 and 11 start at the same time. But everyone comes into a different entrance. So one year group comes into a different entrance. So you will either come through the community door, or you will have come this morning through Haggerston Road Gate, and you will stay with your year group and you will move around the building with your bubble, okay? And your bubble will not mix with another bubble. As you enter the building, everyone washes their hands. It's really, really important. And as you leave the building, you will sanitize your hands. You will have sanitized your hands before you left the building. And we'll talk as well about all of the hand washing and sanitizing that you will be doing during the day. Your parents are not allowed to enter the building, okay? So if you would normally be collected, your parents will have to stay outside of the building, and your parents must socially distance outside of the building. Within the building itself, you will notice some changes, okay? So you will notice that thorough and regular hand washing and sanitizing is now part of what we do at Bridge. Okay, so we wash our hands or we sanitize our hands as you enter school, as you enter a classroom, as you leave a classroom, whilst you are on break, before and after eating, after using the toilet, and before we leave the school. And what you will notice is we have got additional really big, amazing hand wash stations in both of our playgrounds. There are additional sanitizers all over the academy, as well as hand sanitizer in all of the classrooms. There are additional toilets. There are new floor markings for our meetings in Central Square and in the cage. The classrooms have been laid out in a different way, so everyone is now facing forwards. You will be supervised at all times, okay? Other than there might be the odd occasion where you are transitioning from one room to another, but that will still be within your bubble, okay? You are supervised at all times, okay? And this is all because it's really important to keep our bubbles separate, to make sure that everyone is as safe as possible. Our building is being cleaned even more regularly than it was before. So we have a bigger team of cleaners, and the cleaning, the list of areas that has been cleaned, you know, everywhere is being cleaned much more regularly than it was before. And we have got an incredibly clean building. So everything gets cleaned after use. Parents are not able to turn up at school, they must make an appointment. Okay, so if parents do need to meet with anyone at school, they can't just turn up, they must make an appointment, and that will go through your director of learning. Okay, so just to remind us how to wash our hands, super important, okay? So we can see that we start off and we wet our hands with water and we apply some sort of soap or some hand wash, okay? And we rub our hands palm to palm, okay? But we also rub over the back of each of our hands. So not just our palms, we also rub at the backs of our hands as well. We rub palm to palm with our fingers interlaced, okay, to make sure that we are getting into all of the gaps in between our fingers, okay, and the backs of our fingers to opposing palms as well. We need to make sure that we are also cleaning around our thumbs, okay, and that we are rubbing all areas of our hands there, okay, to make sure that we are not just doing a quick, just doing our palms, we are doing every bit of our hands. Okay, and that should take about 20 seconds. So we need to make sure that from now on we are washing our hands thoroughly. Now I imagine that most of you have got into really good habits with this anyway, but make sure that as you are washing your hands, you're paying really good attention to make sure that you are washing every bit of your hands, fronts, backs, in between your fingers, making sure you're washing all around your thumb. Okay, and then we will make sure that we are drying our hands thoroughly as well. Okay, good. So other safety measures that are in place as well is also about minimizing contacts. Okay, and this is to do with our bubbles. So we've mentioned this idea about our school bubbles, different to your support bubbles for all the times we were talking about support bubbles. So our year groups are all in bubbles. Okay, and you are within your bubbles and zoned in separate parts of the building. So on a daily basis, there'll be certain parts of the building that your year group will use and other parts of the building that other year groups will use. Year groups have different start times and different end times to the day. Okay, you will have a specific route and your teachers will use this specific route to lead you to and from your lessons and breaks, and this must not be challenged, okay? And this is something that we really need you to all understand. An enormous amount of work has been put into looking at our building and the way that we can move everyone around the building to make sure that everyone is safe okay, and to make sure that bubbles stay separate to other bubbles, which means that we minimize contacts, okay? So your teachers know exactly what routes to take, what staircases they're taking, which direction they will be moving at different times. So this must not be challenged, okay? It's something that we must all work together to make sure that we all stay as safe as possible. Breaks and lunch will also be socially distanced, so you will only have lunch with your bubble, whereas before you used to have a break and lunch time with other year groups. Now you will not. It will only be with your year group. The playgrounds are also split into 2 zones so that bubbles stay together during break times but remain separate from other bubbles. So there might be another year group sharing the playground over break time or lunch time, okay, but you will stay separate. So we've got the upper playground, which is that middle terrace and the cage, and then we've got the lower playground as well, which runs along the side of the canal. And the lower playground also has access to that terrace in front of the LRC. Okay, staff will remain 2 meters away from other staff and from pupils. Okay, and that is because of the importance of social distancing. And it is really important that you do not touch staff or other students. So remember what we talked about when we talked about close contact, and we talked about skin-to-skin contact, and we talked about being within close contact of other people. And because of that, now it is really important that we do not touch staff or students. And I know that there will be some people, really good friends, that you haven't seen for a long time. And because we are, naturally warm, sociable beings, you'll be really tempted and really inclined to, reach out to touch someone or put an arm around somebody. Okay, we are not allowed to do that now. Okay, and we are all really looking forward to, when COVID goes away. Okay, but at the moment it is with us, and this is what we've all got to do. And we've all got to do this together. So from now on, we are not to touch anyone. So do not touch staff, do not touch students, okay? Parents can request that you are able to wear a face covering or a mask in communal areas, okay? So face coverings and masks are not to be worn in lessons, and that is because if they're worn in lessons, it can really affect communication and how you are able to learn in the lesson. Okay, but when moving around in the building, in those communal areas, you can request, so Mr. Brown has written to everyone about this, and if your parent would like you to be able to wear a face covering, as we change over and in those communal areas, you must ask your parent to fill in that letter, sign that letter, and return it to us, and then you'll be able to get it. You'll get a sticker to say that you have permission to wear your mask. But it's really important that your parent reads that letter really, really carefully to make sure that you are always wearing your face covering or your mask the correct way, and that you are changing it regularly. So daily, it needs to be a new mask, and all of the details about that are on the letter. Okay, and your parents must agree to that if they want you to wear that face covering or mask. Okay, staff will wear face coverings or masks during changeovers or on duty inside. Okay, and then we've also got some additional safety measures within the actual classrooms as well. So everyone will sanitize their hands as they enter the classrooms and as they leave the classrooms. As I mentioned, the layout of the rooms has changed so that desks are front facing. Tissues are available in all classrooms, okay, but please also be in the habit, if you can, of always having a packet of pocket tissues with you. If you feel like you have to cough, or if you feel like you have to sneeze, this is part of our strong respiratory hygiene, okay? You need to make sure that you are coughing or sneezing into the tissue, okay? There are tissues in all of the classrooms. If you're in a location and there is not a tissue and you do not have a tissue, then that is, as we looked at before, you would sneeze into your sleeve, okay? But there are tissues all around the academy, and have your own tissues. And this is part of the catch it, bin it, kill it approach. Okay, so we catch the virus in the tissue, and that stops it from being able to travel further around, and then we put it in the bin. Okay, so catch it, bin it, kill it. After that, you would then sanitize your hands again. In the classroom, teachers will remain at that 2 metre distance away from you in the classroom as well. Okay, so just a couple of what ifs to finish off. So what if I develop symptoms at home or somebody in my household develops symptoms? I mean, hopefully now you should all know the answers to this, but just to make it really clear, you must not come into school. That is really important. If you develop symptoms, you should get a test. You should self-isolate for at least 10 days or until you get a negative test result. If someone in your household develops symptoms, you should self-isolate for at least 14 days or until they receive a negative test result, and then you would follow the guidance, the stay-at-home guidance on the gov.uk website, and the link is there. What if I develop symptoms whilst at school? So you would be collected by a member of the senior team who would probably be wearing PPE, okay, which means that they would have a mask on, they would have an apron on, they would have gloves on. So they would come to collect you, and then you would be taken to the medical room, okay? And the medical room is on the first floor, so it's kind of around the side of the library, and it's in between 123 and 126P, okay? So it's a room there. We would contact your parents, and we would send you home as soon as we possibly could. And you would then have to self-isolate for at least 10 days or until you get a negative test. Everyone in your household would have to self-isolate for 14 days or until you receive a negative test result. So you would have to get a test, okay? And then follow the guidance, and there is a link below. What if someone in your household develops symptoms? You should not come into school. Hopefully now the repetition will really be starting to sink in, and we know, what these things mean. So the person with the symptoms in your household would self-isolate for at least 10 days or until they received a negative test result. Everyone else in the household, so now this includes you, would have to self-isolate for at least 14 days or until that person gets a negative test result. Anyone with symptoms is eligible for a test, and they must get a test. And then again, there is that link to the stay-at-home guidance from the government's website. What if someone at school tests positive for COVID-19? So we would immediately inform the local health protection team, and they would then advise us of the required next steps. So they would conduct a risk assessment to identify anyone who's been in close contact with the person who has tested positive during the period that they were infectious, and they would ask these contacts to self-isolate. Okay, so these contacts must self-isolate for 14 days. People in their household do not need to self-isolate unless that person that is the contact who is self-isolating then develops symptoms themselves. Okay, the health protection team will provide definitive advice on who must be sent home. So we work with them and they advise us. Anyone with symptoms is eligible for a test and should get tested. And there again is that link if you have to stay at home. Now, there is a lot of additional support available for you this year as well. And I just wanted to mention some of this and, make sure that this is here on this website as well, so you know where you can access some support. So we have got a lot of additional support for counsellors, and this is both through Place to Be and our Key Stage 4 and 5 counsellors, okay? And there is also a range of support in a lot of different areas that we have put on the website as well. So if you click this link here, there are a lot of websites there that will be able to provide any support for you and your family in a range of different areas. Okay. So thank you so much for listening so well. I know that your tutors will be asking you a few questions just to make sure that everyone is really, really clear about this, and we will save this to our website as well so that you and your families can watch it from there if you need it. So I'm just going to stop sharing my screen and say thank you very much for listening. And we are all working together to make sure that we all stay as safe as possible. Thank you, everyone, and I will see you soon. Bye-bye.